Hi, we're here from Solstice Physiotherapy. I'm Erica and this is Kara, and we're here to talk about how chronic UTIs can cause pelvic floor disorders.
So chronic UTIs can happen, a regular UTI happens when there is bacteria in your bladder. So your symptoms would be burning with urination, frequent urination, incomplete emptying. So usually you go to the doctor or you go to the walk-in clinic. You'll pee into a cup and they usually do a urinary analysis where they're looking for bacteria, if there's anything going on in there. So most of the time that will usually come back positive, even if there is not an infection. Then usually the second step is they'll send the urine out for culture, where they'll let it grow in the lab for a few days to figure out if there is bacteria. And if that comes back positive, that usually means that there is an infection.
And it's okay to take an antibiotic.
Exactly. It's important to know though that you can really only get a clean urinary sample from doing a catheterization. So that's when they insert a tube into the bladder and withdraw urine. So you want to talk to your urologist about that as well. But so let's say you have all this tests and you take the antibiotics and you're still having symptoms. What do you do?
Right, and this is kind of what we see in the clinic is that patients go and they're getting all of these tests and it comes back negative.
Right.
So, and they're taking chronic antibiotics, but then they're still getting these UTI symptoms. This is when it could be pelvic floor.
Exactly.
So the patients come in and they kind of tell us the story, and you listening here, you might have the same situation. And they come in and then we assess, and we actually assess their muscles, their pelvic floor muscles, and it reproduces the same symptoms that they're having as a UTI. So this is where pelvic floor physical therapy can help.
Because if those muscles are reproducing the symptoms, that generally means that they're tight or that there's something going on with them. So what we want to do is help to relax those muscles so they don't irritate your bladder and trigger symptoms of urinary frequency or burning.
And also what we'll do is, if you come in, we also talk about bladder habits, normal bladder habits. We try and have patients learn how to change some bad bladder habits to avoid any irritation.
Yeah. Also, we'll teach you some stretches and some exercises to help alleviate pain. So if you are having any problems or issues with chronic UTIs, definitely give us a call or visit our website at www.solsticept.com.
Yes, and you can also go to your urologist and ask, or your gynecologist, or a urogynecologist.